My name is Carolynne White, and I'm a registered occupational therapist and president of HAES Australia. I'm recording this video during National Reconciliation Week in Australia. And before I begin, I would like to acknowledge the traditional owners of the land on which we meet and recognise their continuing connection to land, waters, community, and culture. Today I'm presenting from the land of the Wurundjeri people of the Kulin Nation, and I pay my respects to their elders past, present and emerging. In this presentation, I want to share with you some of the collective actions we've taken to end weight stigma and discrimination in Australia and reflect on our achievements and challenges along the way. Before I go any further, I'll put in a content warning. I will be using some use of the O words, which I know is offensive, but I'll only use those in the context of original citations and also when referring to certain policies as well. So this abstract was originally submitted for the Weight Stigma Conference, which was unfortunately cancelled. So we were delighted to receive an invitation from Dr. Kat Porzay to present at the Fat Studies Conference. Thank you so much for the opportunity to share some of the work that we've been doing over the past 2 years. While I'm presenting this work as current president of HAES Australia, I want to acknowledge input from Dr. Natalie Jovanovski, health sociologist from Melbourne University, and the HAES Australia leadership team, including Louise Adams, Mandy Lee Noble and Anna Reeves, and the steering committee members, both past and present. We recognise that as white, educated, able-bodied women, we have multiple privileges that enable us to do this work. Speaking for myself, as a person who lives with thin privilege, weight stigma and discrimination is not part of my daily experience. However, over my lifetime, I've witnessed family members and friends who've been subjected to bullying and discrimination and worked with clients who are treated differently on the basis of their body size. I've come to recognise this maltreatment and understand it as weight stigma 5 years ago, when I was working as an occupational therapist in a community health service in the central eastern suburbs of Melbourne. I was working as a health promotion project officer, conducting a series of consultations with community members about how they wanted the health service to address concerns about body weight. The community members, some of whom you see in the photo here, spoke to us clearly about feeling judged rather than supported by health services. And they reported wanting us to focus on their well-being and not their weight. Throughout this project, I learned that weight stigma is not an individual issue that people can fix by repeated attempts to shrink their bodies. People in our community told us that rather than recommending changes to their body size, they wanted health professionals like me, services and governments to address structural barriers to health and create social, physical, institutional and cultural environments that are more welcoming and inclusive of people with larger bodies. When it comes to understanding weight stigma, I would like to acknowledge that, relatively speaking, I'm a new kid on the block. And I want to pay my respects to fat activists who've been working since the 1960s to end discrimination towards people with larger bodies. In this presentation, I use Calligero, Tilka and Mensinger's definition of weight stigma that refers to the social devaluation, denigration and marginalisation of people who are fat, where fat is used as a neutral descriptor of body size. As Lee and Porzay explain, fat stigma and discrimination is socially produced because of the negative associations with fatness that are created and reproduced by family, the media, health professionals, and public health policy. And as O'Hara and Gregg show, weight stigma and discrimination contributes to human rights violations. As a social justice issue, addressing weight stigma and discrimination requires collective action at a structural level. HAES Australia is a not-for-profit, member-based organisation established in 2017. It was formed by a group of health and fitness professionals to bring together the highest quality training and specialists in Australia for the health at every size approach. From an initial founding group of 10 health and fitness professionals, HAES Australia has grown to just over 200 members. HAES itself was developed by the Association for Size, Diversity and Health from discussions with healthcare workers, consumers and activists as an approach to both policy making and individual decision making. HAES includes 5 principles. So the principles that are most relevant to today's discussion are weight inclusivity, which means accepting and respecting the inherent diversity of body shapes and sizes and rejecting the idealizing and pathologizing of specific weights. In today's presentation, I'll be focusing specifically on respectful care, which involves acknowledging our biases and working to end weight stigma and discrimination. Currently, health systems around the world are guided by the weight-centered health paradigm, where weight is viewed as an important determinant of health and illness. This is clear in the way that research funding is allocated, how policies are framed, and in clinical practice guidelines. In 2018, Australian health promotion academics, O'Hara and Taylor, published a critical review of literature and identified 9 tenets of the weight-centered health paradigm. The final tenet, which we have on the screen here, sums up the gist of this paradigm. That is focusing on body weight for all people, and losing weight for people who are deemed overweight and obese will result in better health and reduce the social, personal and economic costs associated with higher than average body weight. In recent years, there's been an increase in lobbying by public health organisations for federal government action to address their concerns about body weight and health, culminating in a consensus statement released in 2017 called Tipping the Scales, which recommended 8 actions to tackle so-called obesity. The HAES Australia leadership and steering committees have had lengthy discussions about our role and our capacity to respond to these lobbying efforts. As part of these discussions, we've thought carefully about whether to pursue activism or advocacy. Activism is action on behalf of a cause, action that goes beyond what is conventional or routine. According to Charlotte Cooper, fat activism includes addressing fatness critically and consciously and takes many forms, including engaging with political process, community development, cultural work, challenging everyday oppression and dominant cultural norms, and refusing to participate in the dominant culture. Advocacy, on the other hand, is defined as a deliberate attempt to influence decision makers and other stakeholders to support or implement policies that can contribute to improving health equity using evidence. When thinking about how to position ourselves as an organisation, we considered the purpose of the organisation, the resources we had available to us, and our membership. So HAES Australia was established to connect, support and promote HAES professionals and raise awareness of size-inclusive approaches to healthcare among health professionals and the general public. HAES Australia is a member-based organisation led by a team of dedicated volunteers with minimal funding and fewer resources than other peak bodies. It might be useful to think about our membership in relation to the Australian population. So in Australia, we have 25.5 million people. Of these, 67% have a body mass index over 25. In Australia, there are 700,000 health professionals. And among these, there is a systemic bias whereby the majority of health professionals have thin privilege. Of the health professionals in Australia, there's even a smaller percentage who practice in a weight-inclusive, weight-neutral way. And 200 of these have chosen to become members of HAES Australia. Although there are some people who would identify as fat among our membership, the majority do not have the lived experience of having a larger body. So for these reasons, we decided to position ourselves as an advocacy organisation, using our knowledge as health professionals, our learned experience from our work with clients, and our professional networks to advocate for weight-inclusive public health policies and clinical care. Recognising that most members experience multiple privileges, we strive to lift up the voices of people who are otherwise unheard whenever we have the opportunity to do so. As a small organisation, we've had to think strategically about how to use our limited resources to build relationships and partnerships across a range of sectors to maximise our impact. From an advocacy perspective, using a single strategy is rarely successful on its own. So we've taken a multiple strategy approach. So now I'll outline the collective actions undertaken by HAES Australia in partnership with other organisations over the past 2 years to address weight stigma and discrimination at a policy level. So in May 2018, I was working at Swinburne University of Technology with Dr. Natalie Jovanovski. We convened a symposium in partnership with Women's Health Victoria to bring together an invite-only group of 38 stakeholders from across public health, health promotion and policy sectors to talk about how public health discourses about quote-unquote obesity impact women's health. The symposium aimed to critique current public health discourses around women, food and bodies, and identify opportunities to improve structures, strategies and practice. At the symposium, key researchers and practitioners gave presentations that highlighted the barriers that prevent women from having healthy relationship with food and their bodies. Drawing on clinical work, qualitative research, community consultation, and personal experiences, each speaker focused on a different determinant of health, and we covered biological, behavioural, socioeconomic, and cultural determinants. Afterwards, stakeholders participated in facilitated working groups to identify opportunities to improve women's health and wellbeing through public health initiatives that take into account social and structural barriers to health. The feedback from the event was overwhelmingly positive, with attendees commenting, "My thoughts about health professional training in this space have been turned upside down completely." Some of the key takeaway messages was that body weight is the result of many influences, and that body shaming is a huge unintended consequence of many health promotion campaigns that target body shape and size. Other takeaway messages included that weight neutral and wellbeing focused approaches achieve more sustainable health outcomes, and also the importance of listening to community members with lived experience. The one person wrote, "Don't forget to consult or co-produce projects when working in this area." Based on the successful partnership that was developed through planning and facilitating the symposium, Women's Health Victoria invited Natalie and myself to prepare a submission to the Senate Select Committee into the obesity epidemic in Australia. Our submission drew on our qualitative research with low-income women and community members and was endorsed by Women's Health Victoria and HAES Australia. The submission made 10 recommendations, including to critique the premise of the so-called obesity epidemic, which is even more poignant now in the midst of an actual global pandemic, to stop using body weight as a proxy indicator for health, to recognise human diversity and promoting the growth, development and health of all children, regardless of their body weight, shape or size, to reduce weight-related bullying and prevent body dissatisfaction, and to scale up weight-inclusive campaigns and interventions. We were pleased to receive an invitation to give evidence at the public hearing in Melbourne. We extended the invitation to Rita Butera, the CEO of Women's Health Victoria, and Sarah Harry, who provided evidence from her own lived experience. At the end of the hearing, the senators were genuinely grateful for our submission and invited us to give further evidence. Following the Senate hearings, Natalie and I were interviewed for a media release by a corporate writer who shared her own experiences of weight stigma and diet culture during the interview. In response to the media release, a freelance journalist contacted us regarding our submission. During the interview, Natalie and I raised the importance of speaking with people who could talk directly about their lived experiences of weight stigma and put the journalist in contact with two fat activists who were featured in the article. In December 2018, the Senate Select Committee released their final report, and we were pleased to find that the first two recommendations related to stigma, as raised in our submission and evidence presented at the public hearing. The Senate acknowledged the stigma associated with the term obesity and recommended a move away from using that term in public health and healthcare, and to shift the focus from weight to health. Unfortunately, a deep understanding of stigma and the nuances of this shift were not evident throughout the remainder of the report, which adopted many of the recommendations from the Tipping the Scales consensus statement. In the days following the release of the report, we watched the media closely and got crickets. Even though the first two recommendations from the report address weight stigma, these got no attention. Instead, the public health organisations who endorsed the Tipping the Scales consensus statement all put out media releases that emphasised recommendations that aligned with their own. Since then, we've become aware of challenges to progress towards our aim of ending weight stigma and discrimination from a weight-inclusive size acceptance perspective, whereby being treated with dignity and respect is recognised as a basic and unconditional human right. In 2018, in July, the Obesity Collective was launched as a platform for individuals and organisations from across Australia to decrease bias and stigma. This was followed by the launch of the Weight Issues Network, a group of people with lived experience who were committed to breaking weight stigma, began recruiting new members in August 2019. While these developments appear promising on the surface, both of these collectives adopt a weight-centric perspective, where higher body weight is framed as a challenge to be solved, which perpetuates weight stigma. Then, early this year, a joint international consensus statement for ending weight stigma was published in Nature. In the review, weight stigma was defined as social devaluation and denigration of individuals because of their excess body weight, and can lead to negative attitudes, stereotypes, prejudice, and discrimination, and positioned weight stigma as a barrier to weight loss research and treatment. This weight-centric medicalised framing of weight stigma is not surprising, given that all three of these collective actions are heavily sponsored by Novo Nordisk, a pharmaceutical company who are putting pressure on the Australian government to have obesity recognised as a disease and seeking approval for their weight loss drug to be listed on the pharmaceutical benefits scheme. Recognising vested interests masquerading as community action and responding to these external challenges is key to ensuring that policy recommendations addressing weight stigma are implemented. Which leaves us with a challenge. We do not have the money, media, and might of the pharmaceutical industry. So what can we do? Community development approaches offer some ideas to support collective action against the structures that contribute to weight stigma. Cormac Russell highlights 4 ways that health professionals and organisations can work together with community members: the medical model, the charity model, social model, and what I've renamed the self-determination model. For fat studies scholars and activists working with the fat community directly, a self-determination model seems a good fit. Whereas for HAES Australia, whose members are allied health and fitness professionals, where the majority do not live in a larger body, a social model characterised by doing with us, for us, is a better fit. To ensure that everything we do for our community involves them, HAES Australia has established a lived experience advisory board consisting of 6 community members who have a range of lived experiences and meet regularly to contribute to decision making by providing advice and feedback about HAES Australia's activities, plans and policies. In fact, it's on the recommendation of Jenny Lee, one of our board members, that HAES Australia is proudly supporting the Fat Studies Conference. We recognise that Fat Studies scholarship and fat activism is broader than health. However, dominant weight-centric health policies and practices are a major contributor to weight stigma and discrimination. What if fat communities and HAES communities came together as one size acceptance community with a shared vision to uphold the human rights of people with larger bodies and work together to end weight stigma and discrimination? From an asset-based community development perspective, between us, we have some amazing fat activists, HAES providers, and fat studies and HAES scholars, as well as relationships with other researchers and organisations who are working individually and collectively to address weight stigma and discrimination. What if we recognised the unique role that we each play and valued each other's contributions? What if we supported each other's efforts, even though our methods of influence may be different? What if we harnessed the assets and resources we do have and sourced external support as needed? What if we worked proactively and coordinated, mobilised and amplified our efforts? Imagine what we could achieve together. Thanks everybody for listening to this presentation. If you'd like to continue the conversation, we'd really love to hear from you. So please contact us at haesaustralia@gmail.com. And if you'd like some more information about HAES Australia, feel free to go to our website at www.haesaustralia.org.au. If you're interested in looking at any of the references that we've used today, here's a list, and these will be available on the transcript of the video as well. Thanks everybody for your time.